I think today's event is really good for bringing together the community where we are able to better understand where the patients, the caregivers and the researchers are coming from, and to bring the different perspectives together to better advance care for all these individuals. This whole journey involves many people at the center of this journey.
So carry off really meaning because it's very collective with different people from academia and industry as well as patient and patient caregiver. And this forum provides us great opportunity to collectively find the solutions all together. I think rare disease always important to have a better diagnosis, and also access is very important. The affordability and help of patient life with a better access is quite important.
Platform like CareHope Forum is incredibly important because it brings together all the different stakeholders that don't usually get to meet. So like the clinicians, policymakers, patients, pharma, industry, and so many stakeholders to bring together. We often meet maybe one stakeholder at a time, but this is a space where all stakeholders come together and have a shared space. And I think that builds the trust and unity amongst different groups, and so that we can really come together to advance rare disease care. Genetic sequencing is very much available, much more accessible, and definitely cheaper than the last time. So I think with the advancement of technology, it's a real great opportunity for patients to benefit, and I think our role is to create access for patients to these technologies. So when I used to see these patients many years back, often there was no diagnosis because access to genetic testing was so difficult and also expensive. And so often patients had diagnostic odysseys of 10 years or even more, and we couldn't give them an answer many times. But now with the access to genetic testing, we have had patients receiving diagnosis in a number of days, and I think that has been incredibly fulfilling for myself and my team. In medical school, rare diseases and many of these conditions that we know as rare diseases are still not commonly taught in medical school, and therefore clinicians may encounter one in their lifetime or very few. So therefore the awareness, I think, still remains a bit less than what we would hope to see.
So sometimes I might come off as unfriendly or very stone-faced to other people, even when I'm laughing or having a good time. It really can be a huge financial cost on families. And another more personal aspect, in my opinion, is that it can affect your self-confidence, especially if your rare disease is easily viewed or can be seen by other people. Like, even when other people don't judge, like your inner thoughts keep telling you that other people are looking at your face, judging you, whatever. Yeah, it can do quite a bit. It can have quite a big impact, negative impact on your self-confidence. I hope that it can affect policy, more compassionate policy towards people with rare diseases or their families and caregivers, to help them with their disorder, and potentially help to alleviate the financial aspect of having a rare disorder.
First of all, the patients are very proud that we get to have ourselves represented at such a level, and to be able to see partners from industry, from policymakers, and to have their voice heard
about the real concerns they have living with a rare disease, I would say the first thing that comes to mind is they are very proud that they are finally seen. Carrier Hope is just been such a wonderful opportunity for us to be heard and seen. We have our involvement with CEE and ACE, with MOH, and that has really opened up opportunity for us to talk about what our challenges are as a patient population, and one of it would be the financial difficulties in living with a rare disease that can be very costly. Just the fact that we are still quite few in numbers, just within our own community also, not that many patient advocates are willing to step up and to speak about their journey and their story with rare disease. So we do need more patient advocates to tell everyone what are the challenges we are actually still facing.
For people living with a rare disease, time and access is very important. And AstraZeneca is very proud to part of this Carrier Hope Forum to contribute and work together to find the right solution for the rare disease patients. We hope we continue to work together to find a way to help and serve better for rare disease patients.
Patient stories are very, very important because that is the emotive, that is the context. Actually, patient involvement is very critical. At every opportunity and juncture, I think there is a space for patient to come in and lend that voice so that we have a more complete picture of what is the tension, what is it that we are trading off, and what's useful to the patients and the families.